keto diet is really one of the best ways to look after your dental health. And my patients are always asking me, what's the best nutrition? What's the optimal way to eat? What things can I do to enhance my oral health? Well, first of all, if you've got a healthy body that's getting optimum nutrition and getting all the nutrients, macros, and minerals and vitamins that it needs, you're going to have a much better chance of avoiding gum disease and tooth decay. I'm Dr. Rachel, holistic dentist, and I'm going to talk to you today about the keto diet and why I think that is of benefit to your oral health and what the possible pros and cons are as well. Now, personally, I eat keto. I also intermittently fast. I like to keep my body slim. I like to make sure my insulin's under control, that my blood glucose isn't too high, and that my body is in a state of ketosis so that my cells can clean up after themselves. And these markers are helping to keep a body free of inflammation, reduce risk for disease, autoimmune disorders, and even types of cancers. So I'm a really big fan of intermittent fasting and having your blood glucose levels within a good range and having ketones to help your body be fat adapted and fat burning. So let's have a look at the ketogenic diet. Let's have a look at how that applies to your dental health. Now, you may have seen some of my previous videos on eating for dental health and to prevent tooth decay, and I'll link to those for you. And this is going to be a little bit more focused on ketosis today. And if you want to know more about your dental diet, then you can check out my other videos. So some of the benefits are reduced sugar intake, because the two main ethoses of the keto diet is low sugars and carbohydrates and eating predominantly calories from fat. So that doesn't mean that you're eating lots of fat or only fat, but you're predominantly getting your calories from fat, because fats don't spike insulin when you eat, and it tells your liver and your body to produce ketones and use fats that are stored within you as your source of energy. It's a very efficient way of fueling the body, and it also means that once you adapt to that, you actually get full really quickly and you're less hungry, so you just naturally start to lose weight and regulate your weight. But back to your teeth. Primary benefit is you're going to have a significant reduction in sugar consumption. Sugar feeds the bacteria in your mouth, and those bacteria then consume that sugar. They produce lactic acid and they poop that out onto your teeth, and that acid actually destroys your tooth structure, makes your teeth weak, and then the bacteria decay your teeth. By limiting that sugar intake, a keto diet can help prevent cavities and gum disease, because sugar also causes inflammation and it weakens your immune system, as well as letting more bacteria build up in your mouth. You get increased saliva production, and this neutralizes acids in the mouth and it washes away food particles, and it contains enzymes and they fight the bacteria, and that promotes good oral health. Now, I touched on it earlier, autophagy, which I'd been saying for years as autophagy because I'm English, but it is autophagy. Autophagy is a cellular process, and that involves the breakdown and recycling of damaged cells and components within themselves. Now, some research suggests that a ketogenic diet may induce autophagy, which could potentially benefit oral health by removing damaged cells and promoting tissue repair. More research is needed to fully understand the connection between autophagy and your oral health. But when you're in autophagy, you have a very strong immune system and you have very low inflammation, and that has to be a good thing, particularly when it comes to gum disease. So what are the risks? Now, on one hand, it's saying you increase saliva flow, but on the other, you can actually get dehydrated because of the processes that are going on in your body, and that's going to decrease your saliva production. So you may experience a dry mouth, and that can lead to increased plaque buildup, bad breath, and the increased risk of tooth decay. So if you're going to do a ketogenic diet, if you're going to go keto, make sure you're well hydrated. You can get a more acidic environment, and that is not a good thing in your mouth. That can erode your tooth enamel over time, and this is particularly concerning if you've already got sensitive teeth and a history of enamel erosion. But you can combat that. You can use xylitol mints and gums after you've eaten or drank. You can use a mouth rinse of bicarb of soda with a little bit of hydrogen peroxide, and you can swoosh that round and that will alkalize things for you. You can use toothpaste with hydroxyapatite in as well, and I'll link to some of those videos for you. Now, if you do unclean, unhealthy keto, where you're just basically lobbing loads of fat and meat into yourself, and hang on, I don't want to upset the carnivore diet people, just hold your horses here, guys. But if you're eating junk keto, then it can lead to nutritional deficiencies, and you can end up low in things like calcium, phosphorus, vitamin D3, depending on where you're from, which are crucial for strong teeth and bones. So I want you to do healthy keto, and that is where you predominantly get your calories from fat. So you can use MCT oil, which is medium chain triglyceride oil, and that's from coconuts, and that really helps satiate you and helps your body produce ketones. Olive oil, nuts and seeds, which in smaller quantities, avocado. So you're getting your good fats, and then have lots of low carbohydrate vegetables and salad. So I eat predominantly, I have a big bowl of salad, cucumber, lettuce, a little bit of beetroot, half an avocado, dash of olive oil, and some MCT oil. And then I will have a protein, a fatty protein, usually, so like some lamb. I only like lamb and fish, so usually I'll have some lamb, and I'll just have a portion the size of the palm of my hand, because if you eat too much protein, it spikes your insulin and you don't get the ketogenic effect. So I load up on lots of salad, and then I can have things like broccoli and green beans and spinach, Asian greens, because they're all low carbohydrate, but I don't overdo that because I don't want to be pushing my blood sugar up too high. So if you eat that way, then you're not going to be deficient in your calcium, your phosphorus, your vitamin D3. I also supplement with vitamin D3 and K2, amongst a few other things. I'll take MCT oil occasionally, just to help give me a bit more fat reserve. And then that way you're not going to be deficient in anything. But keto's had a bad rap because people have just gone on junk keto. No, they've just been eating sausages. There's not a lot of nutritional value in that now, is there? So you need to make sure that you maintain good oral hygiene. Yes, you're brushing, you're flossing, cleaning in between your teeth. Use a mouthwash. You can coconut oil pull if you like, and this will help protect your teeth. I've said it already, stay hydrated, drink plenty of water, make sure you don't get a dry mouth. Let's have a look at kind of like a very beginner's guide to a ketogenic diet or a keto diet. It's a low carbohydrate, higher fat diet that forces your body into a metabolic state called ketosis, which is basically using fats for fuel. In this state, your body's going to burn up stored fat for energy instead of glucose, which is basically sugars. And to do this, very, very simple. Just significantly reduce your carbohydrate intake, something like 20 grams or less of carbohydrate a day. And that's a very small portion, guys. And then increase your healthy fats. Avoid trans fats. Avoid your seed oils, your rapeseed, your canola, your sunflower, because they just not good for your body. They can spike insulin and inflammation as well. So your healthy fats, your coconut oil, your avocado, your olive oil, and your saturated fats from your meats, guys. You want to moderate your protein, so not too much, because that will kick you out of ketosis. Again, rule of thumb, rule of palm of your hand size serving for your protein. And then make sure that you're going to be drinking a lot, because you're going to be losing a lot of water through your urine. This happens during ketosis, so it's really crucial to replenish your electrolytes like sodium, potassium and magnesium. Now, some people swear by Himalayan salt or Celtic salt. I am not a fan of salt personally. I don't like the taste, so I use a mineral, just a mineral complex supplement that I just pop in my water just to make sure that I'm not getting dehydrated. Dead giveaway if you start getting muscle cramps, by the way. So the food groups that you need to focus on: your healthy fats, avocado, olive oil, coconut oil, nuts, things like almonds, walnuts, and your pecans. You can do seeds like chia, I think that's how you say it, isn't it? Flax and hemp. And then your protein, your meat, beef, poultry, pork, lamb, fish and seafood, eggs. You can do dairy products if you eat dairy. They swear, eating lots of cheese and butter. And your low carb veggies, leafy greens, spinach, kale, broccoli, cauliflower, capsicums, bell peppers, cucumbers, courgette, zucchini, and you'll have a really balanced diet. One of the superfoods for ketosis is sardines. Yep, in that little can of sardines, there's your perfect portion. You've got all your good fats, you've got your minerals and vitamins, you've got your protein, and they're not that interesting to eat, and sometimes I find them a little bit repulsive, but they're very, very good for kickstarting ketosis. You can look up things like 72-hour sardine fasting here on YouTube. You can check that out. But not yet, I haven't finished talking. So limit your carbohydrates, like your bread, pasta, rice, your sugary drinks. You can have fruit in moderation, but it's kind of leaning towards more like your blueberries and your raspberries rather than other fruits. And you want to, again, not overdo that. Avoid your starchy vegetables like potatoes and corn, and also legumes, so like beans and lentils. Again, all those things are too heavy in your carbs and they will spike insulin. Then you're going to be burning sugar and not ketones. Now, the tips for success: start gradually, reduce the carbohydrate intake and increase your fat consumption, and you do that for about a week or so. Then you can start spreading out the intervals from when you eat. I mean, it's good to stop snacking if you can and just have breakfast, lunch and dinner. And then if you can stop having one of those meals, and usually it's breakfast, because you want to fast your body intermittently for as long as you can. So you have your evening meal, then you don't eat again till lunchtime, and then you have your evening meal. And the window between those two meals, if that can be close together, that's going to be really beneficial. But you've got to train yourself to do that first of all. And I always stipulate here, if you are finding it difficult and you are craving something, go open a can of sardines. You'll eat them and you won't want anything else. No, I swear. No, it really does work. You have something fatty. So if you're peckish, you could have some avocado, or, like I did last night, I had some lamb ribs. Oh my God, they were so good. So succulent. And that just, I had one lamb rib and I was good to wait till dinner. You want to track your macros, so you want to maybe use a food monitor, and you can look at then how much fat you're having, how much protein and how much carbs, so you're not just guessing. Take your electrolyte supplements to prevent any deficiencies, and listen to your body. Pay attention to how you feel and adjust your diet accordingly. You don't want to be just a grumpy hypoglycemic and you're not coping very well. Also, I always recommend you talk to your healthcare professional like your doctor before you start any diet. One way of checking that you're actually in ketosis is using ketone test strips. This is mine. It's a keto diastick. It's got these charts with different colors. This one's for your glucose levels. I mean, these are devised for diabetics. This one here, this is for your ketones, and this helps you to see, the level whether you've got no ketones or you're very high in ketones. And basically, you can either catch your pee in a container and then dip that in, and you wait the time that it says, and you check your colours against the scale, or you can just pee onto it and do it the same way. And that's a very good way in the early stages of checking if you're in ketosis. Now, as you go further on and your body starts to fat adapt, your ketone levels can actually start to seem like they've dropped. And it's not because you're not making ketones, it's because you're so efficient at using them. And that's when using a blood glucose and ketone monitor. So you basically pee on that strip, check your coloured ends, compare your colours, and then you make sure that you're in ketosis. You can use blood ketone meters, far more accurate than your urine test strips, but they're also more expensive. And look, at first I was really freaked out about, using the little lance thing into my finger, and it actually doesn't hurt. But that is another way, if you take this quite seriously, that you can test your glucose and your ketone levels. Now, when starting ketosis, just a couple of words of warning. You may experience what's called keto flu. This is like a temporary set of symptoms that can occur when you first start the keto diet. That can include fatigue, headache, and irritability. And that's because your body's starting to have to switch fuel sources. It's probably doing a little bit of a detox as well, but you do get past that. I find that if I get a little bit headachy or fatigued or lightheaded, I just take something fatty. I'll have a little bit of MCT oil, just smash some avocado, or I'll have my sardines. Yes, sardines. If you're not losing weight on a keto diet, then it's because you're not in ketosis, essentially. And that's why you've got to check with the keto sticks to determine whether it's actually working for you or not. Two really, really big benefits of keto diet are your overall health. You're going to lose weight or regulate your weight. You can push your body into autophagy, which helps to limit inflammation, clean up things going on in your body, and has also been shown to help reduce the risk of neurodegenerative disease, autoimmune disease, inflammatory conditions, and even cancer. And from your oral health aspect, all those things are of benefit because healthy body, healthy mouth, but you're also going to be limiting and really reducing the amount of sugar and carbohydrate that you're having, and therefore you're starving the bacteria in your mouth that build plaque and cause tooth decay and gum disease. Now, if you want to know more about the specifics of how to eat to prevent tooth decay and cure cavities, then check out this video over here.